Have you ever heard of osteoarthritis before? Well, osteoarthritis, which is also called OA, is a very serious health condition, hence needs a serious medical attention. So then someone may ask, what is osteoarthritis in the first place? Yes, osteoarthritis is a degenerative joint disease causing progressive wear and tear of the joint cartilage. So osteoarthritis usually affects joints, okay, as a result of the wear and tear in the joint cartilages. The joints that are being affected are not limited to only the knee. Mostly, people talk about knee osteoarthritis, but then we have osteoarthritis within each and every joint in the human body. Talking about your fingers, talking about your wrist, talking about your elbow, anywhere, any joint in your body, osteoarthritis can affect those joints. Now, there are types of osteoarthritis, and then they are as follows. Let's get in. One, we have primary osteoarthritis, and then that one is age related, okay. And then with the second one, which is secondary osteoarthritis, that one is it occurs as a result of joint injury and then trauma to the joints, okay, and then maybe other conditions. The third type has to do with erosive osteoarthritis, which is characterized by bone erosion or the joint deformity. Okay, now let's move into the causes. Someone may ask, what actually causes this serious health condition? You may be waiting. Let's move into the video. So your age can also cause that. Mostly old age can cause osteoarthritis. Secondly, we have genetics, okay. That has to do with your genes. And then we have obesity. That is why you need to take your diet very serious. Mind what you are eating and then involve yourself in regular exercises, well-planned exercises. The next cause has to do with joint injuries or trauma. And then the final cause has to do with repetitive strain. I have extra ones also. Hormonal changes, that is menopause especially. This condition is actually common in females. Yes, and then the last cause, which is more common amongst us, is sedentary lifestyle of inactivity. We cast you out in Jesus' name. That was just by the way, yeah. But then you need to involve in physical activities. Keep yourself active. If nothing at all, keep yourself active. So here are some risk factors of osteoarthritis. Now, the first one has to do with family history. When this condition is within your lineage, then you are at a higher risk also getting it. Then we have previous joint injuries. Okay, when you had some injuries with your joints, you are liable to this one too. And then we have obesity, I explained earlier. And then we have age, that is mostly old age. Gender, mostly common in females, according to research. And then, yeah, we have other medical conditions also, such as diabetes, causing that. Now, let me send you through some symptoms that you may be experiencing when you have osteoarthritis. They are as follows. First one has to do with pain or stiffness, especially after rest. The second one has to do with limited mobility or flexibility in the affected joints. Okay, and then the surrounding muscles, talking about flexibility, and then limited mobility, talking about the joints. And then we have swelling, okay, or inflammation around the joints. Then we also have grinding sensations. That is the sound that comes with the affected joints, okay, called crepitus, which is the grinding or crunching sensations. Okay, yes. And then we also have morning stiffness, which is actually less than 30 minutes. Then finally, we have loss of function or disability. I mean, you can't do what you were able to do earlier on when you have this guy. Yeah, let's move into the stages. So with this condition, we have 3 stages, and then they are as follows: the mild stage, the moderate stage, and then that of the severe stage. So the first one, talking about the mild stage, is when there is minimal joint damage, okay, which is it brings about occasional pain, okay. And then the moderate one has to do with a noticeable joint damage, okay, where we have frequent pain, okay. And then the severe one has to do with advanced joint damage, constant pain, and then significant disability. This is where, in fact, you wouldn't get it easy. Now, as I said, I'm a student physiotherapist, and then when I don't talk about anything physiotherapy, talking about a physiotherapy management, then I don't think the video is going to end. So let's move into the physiotherapy management. So as a student physiotherapist, I am looking at managing my patients with osteoarthritis. The first thing I'm going to consider is education. I'm going to educate my patients on the condition and then the role of physiotherapy so that the patients will know what to expect from me whenever I'm treating or rehabilitating him or her. So that's the first thing that you are going to consider as a physiotherapist. The second one has to do with pain management techniques that we are going to apply so as to make sure the patient is being relieved a bit of the pain. And then the third thing is we have personalized exercise programs based on the individual patients. We are going to prescribe the necessary exercises for our patients, specified one and then personalized ones. And then the next one has to do with manual therapy, okay, to improve the movement within the joints. And then the last one has to do with improved balance and then gait in our patient to enable adequate ambulation to take place. Yes, guys, this brings me to the end of the video. Thanks for watching. Don't forget to subscribe, like, comment, and share. And then wait for the next video. See you guys. Bye.